Welcome to the Confidence Through Health podcast. My name is Jerry Schneider. As a health, wellness, and sports performance coach, my goal each week is to bring you experts to help you take control of your health and build your self-confidence. Thanks for including me today on your journey to better health. I'd like to thank our sponsor for this episode, All In Health and Wellness. If you're looking for a health coach, you're looking for a sports performance coach, you're looking for nutrition guidance, like for instance, a meal by meal plan that will help you understand how to eat. It will teach you how to eat, and it will give your body, your cells, the proper nutrition to feel great and be able to perform at your best, not just physically, but also emotionally and mentally. If you're looking for those things, you're looking for the key to improve your sports performance, both from a nutrition standpoint and an exercise physical standpoint and a mental standpoint as you approach your athletic event. All In Health and Wellness is able to help in these areas. Go to allinhealthandwellness.com and you'll find the contact information for how to get in touch with them and get started on the plan that will improve your life. So, Dr. Patricia, I want to thank you for being a guest on the Confidence Through Health podcast.
Thank you so much for having me. Happy to be here.
And one of the reasons why I wanted to have you on is because, and I actually had a guest on a few weeks ago that talked a little bit about blood tests, and we got a little bit into that, but that wasn't his specialty. But looking at things like, how do we know where the true root cause of our issue is versus just treating the symptom, right? And that's something that you have taken your practice into with all of your experience and going, wait, we can give a Band-Aid to it, but how do we find the root cause, right?
Yeah, absolutely. And Western medicine, unfortunately, is a lot of, let's put a Band-Aid on it. If you have a symptom, let's try to, give you a medication for it or, really anything. And we don't really do a good job of being proactive and sort of like taking the approach from like, what can I do now? And what are the things that, I should be aware of? And one of the biggest things that I found was blood work. So I've been a nurse for a long time, and the way that I was taught how to look at blood work really was to memorize lab values. And if they sort of like were outside of the range, they would become flagged, and really physicians would use that to diagnose and to formulate a treatment plan, whatever that was. And it wasn't until I became a nurse practitioner much later on when I had patients really asking, well, what do you know about alternative, natural stuff, integrative approaches? What do you know about ways that I can, take a supplement that hopefully will have positive benefits rather than trying to go with the medication route first? And I found that I didn't know. That's not how I was, that's not what I really do.
Right.
As a nurse practitioner, it's, I work in mental health, and I also work with adults as far as their physical symptoms go, but it's, oh, here you go, here's your medication. And I found like there's definitely something. I was always interested in using nutrition as medicine, looking at the natural approaches and just supplements and all of that, but I never had formal training in it. And I recently kind of like fell into this functional blood work specialist. And what I found was that there's a lot of answers hidden in the blood work if we look at it from a functional approach. So the functional way of looking at, blood work is we're looking for optimal ranges. So of course we can see if things fall outside of the range, but unless they do, there's not really going to be any push to treat anything unless it becomes a problem either way. So I found that was really like a disservice. And I found that working with adults, and just people in general, they would say, geez, I've been having these health issues, these health symptoms, these, and I go to my doctor, I have a physical, I get blood work, and they tell me everything is fine, but yet I continue to feel like crap.
Yeah.
So I'm like, Oh, yeah. Why is that? And I just knew from working with patients, my mom experienced this too. Like she just had all of these GI things, and every test, everything came back fine. And,
Mhm.
let's just check again next
Right.
year. I found like there's definitely something that I need to look at. So by really working with people who had these vague symptoms and were told like, everything is fine, they really didn't have a place to go and they really
Mhm.
didn't know what to do. So I love the functional aspect of it because, it might be within normal limits, but it doesn't mean that that is the healthiest or that you're going to feel your best.
Right.
So I really love that. I can delve a little deeper because even things like depression, that can just be related to, your gut not being healthy.
Right.
And we don't look at the gut first and see like, what can we do? Maybe if we fix the gut, we can see that there's an improvement in your mood. But we don't
Yeah.
do that as traditional practitioners. It's, oh, you're feeling down and depressed. Well, here's this medication.
Right.
So yeah, it's really it's really something that I love to do. And I love to sort of use this approach on my patients. And it doesn't mean that I'm anti medication. I think they're wonderful. They're life-saving. They do a lot of things,
Right.
but we should definitely have other options available to us. And if it is that it's medication, wonderful. But if it's something that can be solved by correcting a nutritional deficit or a micronutrient, well, isn't that great? That
Yeah.
we can avoid medications and the risk of the side effects that they come up with. So
Right. Right.
yeah.
Well, and so a couple of things in there. One is like, and it may be a little bit of a side note over the overall conversation, but when those patients that are told your blood works fine, right? But they know that they're not right. Like something is off with their system. They see this, the symptoms, all those things. How much of that then, like if they just keep being told everything's fine, you're normal, like how much of that then creeps into mental health issues, whether it's depression or anxiety or just like nobody understands me type of thoughts? Is that pretty common that people head that direction?
Yeah, because they think, well, it must just be me. Like, am I
Yeah.
crazy? Like, why isn't anybody taking me seriously? And then it affects your mood, your
Mhm.
depression. Like nobody takes me seriously. Everything, if everything is fine, I just must be crazy. Maybe I need, a medication
Mhm.
for, whatever. But yeah, it can be very, very frustrating. It can lead to people not really seeking out, solutions for
Right.
their health. They're like, okay, well, nobody, if I'm going to just get the same like brush off, then like what choice do I really have? And then they maybe try to go it on their own.
Mhm.
I'll try to eliminate this from my diet or that from my diet. And maybe I'll just spend a bunch of money on supplements that I don't even know if they're really going to do anything for me. But
Right.
it does leave people with, feeling really frustrated.
Yeah.
And yeah, it definitely happens.
And on the supplement side, just so everybody knows, like I'm assuming what you're talking about is more of like, okay, well, something that's high in vitamins, minerals, thing like that, versus what I think a lot of people think of supplements is, you go into GNC and you get a protein powder or something like that. Like
Correct.
those are two separate things, but usually termed the same.
Correct. Yeah.
Yeah.
So the supplements that I'm talking about is, um, pharmaceutical grade. They've been, tested and they go through the same process as if it were a medication. And, you're getting quality, nutritional support, whether you're looking for a good calcium or a vitamin D or a vitamin B, because this industry is not really regulated. We don't really know what's exactly inside of the supplements that you get. So I like
Right.
to provide or at least point people to the direction where these are the ones that you want because they've been tested, they've been through a vigorous process, and it's voluntary. They don't have to do that. So
Right.
that when you take this, you're not going to be wasting your money, and it's good quality supplements that are going to help you as far as like bringing up the nutritional deficiencies, vitamin D, vitamin B, or, whatever it is,
Yeah.
that, that can help and help, sort of, get our health, back where it needs to be,
Yeah.
and, feed the cells what it needs. And then hopefully when we do that, and we do that in a way that's, um, a routine, then hopefully we can avoid consequences down the line,
Right.
illness, disease, that sort of thing. So,
Right. Well, and to get back to the blood work piece of it, one of the things that and my wife falls into that category sometimes, of, oh, your blood work's normal, but there's issues, and it's like she'll come to me and she's like, okay, they said everything's normal. What do we do? Um, and but my doctor, or our doctor, one of the things that he does for me myself, I'm usually like spot on health, blood work's normal. He like sort of laughs like, yep, that's what I was expecting. But it's more of a, okay, how did it change from year to year?
mm,
Right? Because I may be normal, but like, is something ticking in the wrong direction to where if I don't change something that I'm doing that's having a negative effect, maybe 5 years from now or 10 years from now, it won't be normal.
correct.
Right. And then like, okay, well, when it's not normal, it's not just you woke up and things changed, right?
Sure.
Typically it's like it's that chronic, and it becomes then a longer process to fix it, right?
Correct. And to figure out too.
Right.
So it does become this, long process. And yeah, over time, you might fall within the normal range, but over time, like if you don't do anything about it, well, you'll end up in a point where it becomes outside of the range, and it may require medication, it may require surgery. There could already be damage to the cells.
Mhm.
So, why aren't we like trying to see, well ahead of that, meet somewhere in the middle? Because yeah, that could end up happening. And these things do develop slowly over time. It doesn't just happen from one day to the next. It
Right.
definitely happens and evolves and goes on for years before it really becomes evident that, oh, okay, that's why I feel this way.
Right. And a lot of times when you look at the functional medicine side of things is looking at the whole body, right? And not just,
Correct.
okay, well, whether the blood work showed something or whether it's just my symptoms are saying that, okay, it looks like you have something wrong with your liver, for instance. Like you're going to then look at it and go like, okay, what's the rest of the body relating to? How's it relating to that? What's it telling us, right? And so
Absolutely.
the
Yeah.
liver may just be like, I just can't keep up with everything else because this other problem over here is creating a bigger issue.
Yes. And when we look at, our body in life and in health, everything begins at the cellular level,
Mhm.
cells of the body. So all of the symptoms and disease can be really traced back to the cell level, of the body. So, um, and that's where we get into, in order to get well, you have to sort of fix the cells. So it
Mhm.
isn't just going to be like, let's give you the vitamin D, but if your cells are not susceptible to receiving it because they've, incurred some sort of like damage, then you're not going to be able to get the nutrients absorbed. So we have to look at the cells and sort of like look at the cells of the body, look at the cells of the brain, look at the cells of the gut, and really take this whole approach,
Yeah.
which is going to be the best way. Even the microbiome, we want to look at it in the cellular level because that's where it all begins. So we
Right.
really have to go back to the basics of what do our cells need the most, what do we need to do in order to make them happy, and what can we do to make sure that they have everything they need, because then it's going to affect every organ in the body, all the tissues in the body. So it's going to have a whole effect throughout, and not just one little portion.
Right. So is that why if somebody gets a blood test done and they may be And I use the word deficient probably in the wrong way in this example, but they may actually be deficient in the cell of vitamin D, but their blood work shows, oh, your vitamin D is fine because it's in the blood, but it's not getting into the cell,
To
right?
the
Like,
cells. Yeah.
is that a legit thing that can happen? And so like that throws people off.
Yeah, absolutely.
Yeah.
Yeah, absolutely. And that's where we have to go back right, to the cell because
Mhm.
that can happen. The cells might not be able to have like their membranes might not be intact. So yeah, it's circulating in the blood, but it doesn't mean that it's, feeding the cells so
Right.
that way it can work properly and support the rest of the body with what they
Right.
need to do. Yeah.
And so in that instance, if you were supplementing vitamin D to make sure that you got enough and it wasn't getting into the cell, you're basically just wasting money at that point until you
Yeah.
go and say, okay, well, what's really going on at the cellular level and how do we fix that? Right.
Correct. Correct.
So that's
Yeah.
a whole nother level of frustration.
Yeah.
Like, oh my
And things
gosh.
like underlying viruses and, bacterial infections and all of that, that's another thing that I find in a lot of the patients that I work with is that their blood work is normal, but when I take a closer look at it, I find that there's underlying bacterial infections. Now, it isn't
Mhm.
going to be high enough where it's going to be flagged, but it's definitely causing some of your GI issues, your bloating, your constipation, your diarrhea, your even joint pain, things like that. Another one is, the underlying viruses
Right.
that they're not high enough, but they're definitely can be the cause of your chronic fatigue symptoms. And really the underlying or the low grade viruses are really the biggest trigger for autoimmune
Mhm.
disease. So again, they're not going to be high enough to say you need an antibiotic, but they're definitely changing the cells and how they
Yeah.
function, within the body. So underlying, viruses and bacteria is definitely something that we want to look at and make sure that we address because that could be, again, I'm tired all the time, no matter how much sleep I get, or gosh, I have brain fog or whatever it is, but everything is fine. So maybe it's just me.
Right.
Um, so that I see a lot. Also things with maybe parasitic infections, that can be something else that I can look at in the blood work just by looking at the different types of white blood cells. I could see like, is this a parasitic infection or is this the result of a food sensitivity? So
Mhm.
if the patient has eliminated all of the things from their diet and they're still experiencing GI symptoms, then we have to look at maybe that's the type of infection that they have
Right.
and treat it. Otherwise, it's just going to continue,
Yeah.
continue on. So there's lots of different things that we can look at.
Yeah. And those, when you're talking about looking at that blood work, those are different tests than just the standard. You go in for a physical, they order a blood work, and
Yeah,
everything looks
it's
normal. Like there's a whole there's multiple levels of being able to do this research through blood, right?
Yeah, and this so when I look at the different types of white blood cells, it really is your basic CBC, your complete blood
Okay.
count. But you want to make sure that if you're getting it from your physician or you're asking for it, you want to get the differential because with the differential, it's going to show you the different types of white blood cells. So a regular CBC with differential is, what you need
Okay.
in order to get that. I also like an iron panel. I like a thyroid panel. I like the blood glucose
Mm-hmm.
panel as well. Cholesterol panel is another one that I do. And if people really want the hormones, then I suggest getting the complete, hormone panel and not just the testosterone. So those are,
Right.
again, those are not special labs that your providers should balk at getting. But it can definitely give you all the information that
Right. Okay.
you know that I
Mhm.
would need. And of course, there's additional tests for things like um, toxicity levels and specialized tests for that if we need to go further. But just getting those basic labs can give us a lot of information and can help patients at least find some answers to why they're feeling a certain way,
Mhm.
and yet they're being told that everything is fine.
So it's not necessarily a different test. It's just making sure that they know how to read the tests properly.
Correct.
Yeah.
Yeah. Yeah, correct.
Okay.
And even a thing like, a simple vitamin D level. So Western ranges, a vitamin D is anywhere between, like, say it's 30 to 100, and that's a huge range.
Yeah.
And with functional range, we like that to be closer to between 50 and 80. Now, if it's 30, it's going to be normal,
Sure.
nobody's going to say really, make sure you increase your vitamin D, but you can see that it's not optimal. So we want to make sure that we push it over to the 50 to 80 because the vitamin D level is important in our immune function too. And if we make sure, that our immune system is functioning properly, then, that can give us a lot of added benefits too. So that's just one example of, a functional range as opposed to Western. We
Right.
really want, this is going to be where everything's going to be working great. So let's make sure it's right here, as opposed to, well, everything is working fine here.
Yeah.
There's no really neat reason to do anything about it. And that's
Right.
the nice thing about the ranges being much more narrow, because we can really, focus on, where are we going to be feeling the best, as
Right.
opposed to just good enough.
Right.
Yeah,
And I'm assuming that's what helps you figure out like and narrow down where is the root cause. Because if we
correct.
can get everything to our optimal level, or even if like 90% of it gets to optimal and then 10% doesn't, that gives us ideas of like where we may be experiencing issues and can dig deeper.
Absolutely.
Yeah.
Yeah. It does help, it definitely helps us, narrow the focus down a little bit more than just, well, it could really just be anything, and
Yeah.
it would be hard to, to do that. So it
Mhm.
really does help us narrow down the focus of getting to the root cause. And that's what we try to do. We try to get to the root cause. What is causing the fatigue, instead of, oh, just you know, take this vitamin and hope that your energy increases,
Right.
or whatever it is. But we
Right.
really try to figure out what's going on. So that way we can correct it and we can maintain it, and, and live our best lives if we do
Right.
that. We really try to
Right.
figure out what's going on. Like, what's the cause of my depression?
Mhm.
We don't really look at that. We basically do a screening. How long have you been feeling this way? And then here are the medication choices for it, rather than like, is your depression related to your gut? Is your depression related to the fact that, your GI tract is not producing enough serotonin, because we need that to feel good. But,
Right.
if we look at that first, wonderful. We have more tools in the toolbox.
Right.
Can definitely help us narrow the focus to
Yeah.
where, it needs to be.
So when that cell gets damaged and it's not able to function optimally, and say, it is a vitamin deficiency, we fill that vitamin deficiency, we fix it back up. But how do we then go about like, okay, we quote unquote healed the problem. How do we not make sure that we recreate the problem, right?
Yeah.
Is that
So
just a lifestyle change?
yes,
Yeah.
many times it starts with basic, making sure that our nutrition is, we're making good choices. We're drinking enough water and fluids throughout the day. We're going out and getting some fresh air. We make sure that we are getting enough sleep. So all of these things have to work, together, because we can correct sort of those nutritional deficiencies or the cells, but if we're going to choose to have a crappy diet, then it kind of defeats the purpose of what we're trying to do. So
Right.
it is this holistic sort of approach. We want to make sure that we're, exercising, because it's good for our bones, and it's good for our mental health, and it's good for all of that. And of course, our food choices, are very important too. So all of that has to be taken into consideration, because if you're only doing one thing, then that's only, your health is like a puzzle. So you want to make sure, like, the more puzzle pieces that you have that fit together,
Mhm.
the better you're going to feel, overall, and the
Right.
clearer that health puzzle is going to be to you, if you're doing all of the things that, contributes to living healthy
Mhm.
and being healthy.
And that's ultimately how you change like the longevity outcome of life, right? Because like statistically, the majority of us are going to spend years in a nursing home or assisted living facility or something where we're being cared for. And I think most of us would look at it and go like, I don't want to live that way. But statistically, that's where, if you're following the Western diet, it's typically where you're going to wind up.
Yeah.
And so it's like, if we fix these things now, diet related or stress related or whatever it is, and learn how to, then we can improve not just now, but also that that longevity piece of life and actually have a quality of life when we're in our 60s, 70s, 80s, 90s.
Oh, absolutely. Even things like, our diet, you can reverse diabetes, type 2 diabetes with your diet. These
Mhm.
are things that you can do.
Yeah.
So, yeah, just imagine. I mean, diabetes, high cholesterol, high blood pressure, those are, really number one killers in the United States.
Yeah.
And we don't need to depend on medication to reverse that. If we
Mhm.
just, start exercising, losing weight on our own, bringing down our stress levels, cleaning up our diet, having a lot more plant-based foods in the
Mhm.
diet, for example, we can reverse some of these things.
Right.
And we want to use everything that we can,
Right.
and we can reverse those things. We can drastically reduce the risk of cardiovascular disease and
Mhm.
type 2 diabetes just by what you eat and the food choices that you make. And it's
Right.
not complicated, but yeah, it can be challenging for people because they don't really
Right.
know, like, what to do or the best approach. But
Right. Well,
yeah,
and for somebody that's actually dealing with that, right? They've got type 2 diabetes. It's already been diagnosed. They're living with it. And so, they're either they're facing that, okay, I'm on that next doctor's appointment is we're talking about the medication, or they're already on the medication. Like that's they should view that more as a stopgap than a lifetime, right? It's like, okay, I'm on
yeah,
this. So it's my acute thing. It's good that I'm on it because it's
yeah,
helping me, but like it's more of a emergent, I've got to
yeah.
make some big changes
It's a wake
now.
up call, because
Yeah.
just because you've been prescribed the medication for high blood pressure or type 2 diabetes doesn't mean it's a life sentence.
Mhm.
It means, okay, now it's a wake up call. If I decide to make these changes in my life, I can drastically reduce the need for them over time. And yeah, it's definitely something that, it's not a forever thing. It
Yeah.
should definitely be a wake up call to say, maybe I need to do something about,
Mhm.
my choices and what I'm doing, and make sure I lose the weight if it's the extra weight or whatever it is, my
Yeah.
lifestyle. So yeah,
Yeah. And it that's where from my point of view, you look at it and you go like, okay, well, I need to get, whether it's a health coach or a functional medicine doctor or somebody else, if my doctor is saying, nope, you're on this medication and it's just the way it's going to be, right?
yeah,
You don't have a choice, right? If they say something like that, it's like, okay, we need to, you know, do that for the immediate save your life, those types of things. But okay, now I need to start looking at other options because that's just not right with what we know with research and how to live.
right, right, exactly. And I mean, ideally, your physician, the first approach should be, let's try to see if we can get you to lose a little bit of weight,
Mhm.
if that's the cause. But sure.
Right.
But and that's why I don't like that, because then if you just give a patient a medication, then it's like, okay, well, this is all I need to do then, and then I'll be fine. I won't really have to do anything else.
Right.
So yeah, and that's the approach that I think sometimes people get, is that they're looking for this magic pill. The
Mhm.
pill's just going to solve everything, and I won't really have to do any of the work. And it doesn't really work like that. I mean, just like
Right.
losing weight, sure, you can find a pill that's going to decrease your appetite and you'll lose weight. But then what happens if you stop taking that pill?
Right.
Like, if you just go back to your old habits, you're just going to gain the weight. So
Right.
yeah, it's great that you maybe can start off with that, but just going forward, know that, okay, if I want to maintain this weight or this level of health, I need to put in the work, whether it's exercise or making healthier choices. Yeah.
Yep. And then like looking at that and not it's so difficult in today's world because it's so counterculture, right? Because the culture is just, oh, try this diet, or you're looking at, oh, this person just did this, and so I'll just try that. But we're at the cellular level, we may be the quote unquote the same because we have the same pieces of the cell, but that doesn't mean that everything works the same for every person, right? Like
Yeah.
it's a unique approach, even though it may be, like 90% the same for everybody, but that 10% is very unique in how it actually works for you. And that's probably the most frustrating and challenging piece for people, right?
Yeah, and that's another great thing about the functional medicine approach is that the treatment plans are tailor-made, for each individual, as opposed to this is the standard of care and this is what we do for every patient that has this new diagnosis. And we don't really make it personalized and about, the patient taking their unique perspectives, their beliefs, what's important to them. So that's another reason why it's so great, is because it is customized per patient.
Yeah.
Um, and it's not a one size fits all.
Mhm.
It's much more individual than that.
Right. And how much of when what you see with your patients, like how much of it is physical difficulty of making the change, and how much of it is mentally like, oh my gosh, I've got to make all these changes?
I would say the biggest piece is the mental
Yeah.
piece of it, because people don't like change, even if
Mhm.
it's for the better, just people don't like it. They just stuck in their routines. I've always done it this way. It's very,
Mhm.
very difficult to change unless I really have a good compelling reason to do that. So I
Right.
think mentally is the most challenging thing, to do. Like if I say, oh, well, we're going to change your diet, you're going to go to the gym every day for at least an hour a day, and you're going to give up all these things, you're like, no, that's not going
Right.
to happen. Because mentally you're like, I don't want to be prepared for what that is.
Mhm.
But if you start off with just, on your lunch break, go out for a walk for 10 minutes and try to get that maybe twice this week, but maybe next week, try to do it, 3 times a week or what have you. I think that sort of helps
Mhm.
break the, oh my gosh, automatic, like, no.
Right.
And you break it up into chunks that are a little bit reasonable. And then over time, the patient ends up developing it. It becomes like a routine, like, oh,
Right.
okay, great, instead of like, so I think mentally is the biggest thing. How much of, I don't have time to go to the gym.
Mhm.
My schedule is too busy. And, it's automatic. Like they're always, it's the mental, like I can't fit it in, or, what have you. That's the biggest challenge that I find, is that it's going to be too difficult. So why should I try? I don't have time.
Right.
I'm too busy, I've got the kids, and
Yeah.
it's very easy for all of us to do that, but you have to
Oh
make it
yeah.
a priority,
Mhm.
this is the time I'm gonna set aside, even if it's 10 minutes for now, because that's all I have, great, you start with that,
Right.
and you work your way up.
Yeah.
And over time, it becomes second nature.
Yeah. And then like, so for the person that's struggling with those changes and looking at it going like, okay, well, how long is this going to take? Right? Because I could just go over here to a traditional doctor and get this medication and just figure out a way to pay for it every month when the insurance, balks at it.
Mhm.
Um, but how long is this change? And I know that's a totally individualistic question because, right, like how long were you in the poor position before you wanted to make the change?
Mhm.
But from your point of view, like, is that something that can be nailed down of like, well, if you start doing these things, you will see change within, you know, 3 months, 6 months, a year. Because that's typically from what I deal with people is like to get that ball rolling, right? You want something that like, oh, I saw
Yeah,
some change. Okay, let's
yeah,
keep going, right?
yeah, for sure, for sure, and it depends, if it's something with weight,
Mhm.
or if it's something, I mean, usually with weight, people want that quick fix, and it does take time. And the slower your adaptation is to the routine and to all the things that that you're going to do, the slower that's going to be.
Mhm.
So eventually, yeah, if we do all of the things, then I would say within 3 months, really. I have people on 3-month programs. And sometimes after 1 month of being on a program, they already can tell,
Mhm.
I have one patient who is on, a 3-month 90-day protocol. And I spoke with her recently and she mentioned, like, I used to have these, like, my hands used to just hurt, my knuckles. And after like taking these, or being on your program for a month, I noticed that that's no longer an issue. And that's
Right.
just within the first month or within the first few weeks, people will say, oh, I already noticed like an increase in my energy.
Mhm.
Some people, it will take a little bit longer, but you can see some of those benefits early on,
Yeah.
right away. And then it will motivate you. And then you're like, oh,
Right.
I want to continue to feel this way, or,
Yeah.
not have this pain. So it just motivates you to continue on. But yeah, we could definitely see some changes, early on within a month or two,
Mhm.
again, depending on what we're trying to correct and what we're trying
Right.
to fix. Sometimes it could be a little bit longer, but within 3 months, people usually are feeling much better,
Yeah.
than they did
Well,
at the beginning.
and that's the great thing about the way that the body works, right? When you look at the whole body and you go after the root cause, like it rewards you in a way of saying like, oh, thank you for doing that. Like let's reward you, make you feel better, and keep going that direction versus like I'm just stuck in this like overwhelmed, like you said before, the immune system's just on high alert. And so I can't possibly feel good because all this other stuff's going on behind the scenes that you might not have a clue that's going on.
Yeah. And we really, the body is designed to heal. And if we just allow it to do that,
Mhm.
and give it what it needs in order to do that, the body will know what to do.
Yeah.
And we just have to, support it along the way and allow it to do what it does, the best, which is
Yeah.
repair and do all of these amazing things. We just have to give it what it wants so that way it can do its job.
Right. And typically, I know it's like in the acute situations, yes, but typically it doesn't want medication.
Correct. Yeah.
Like
Yeah.
because there's so many other things involved in that, but typically it wants, good nutrition, vitamins, minerals, all those things that it needs to work. And and I know from talking to many, many doctors, like going through med school, that they don't get that. They don't get taught that.
Yeah.
Like and if they do, it's just a very, very little bit that it's touched on. Whereas somebody who's going at it, looking at it from a functional standpoint and understanding, like you said earlier, that nutrition is a huge key to feeling better. Like I would imagine you're constantly in that nutrition, like let's learn, let's see what research is showing, what's the new thing, how is this reacting in the body? Um, and so going to somebody that has that background
Yeah.
makes a huge difference.
It does. And you're right about, like I remember, did I even have a nutrition course in nursing school? I'm not even sure if I did.
Yeah.
And if I did, it was really nutrition related to certain like chronic diseases or illnesses or whatever. And it
Mhm.
was more like, oh, if the person has this, they should avoid that. But
Right.
we really, we never looked at food as medicine.
Mhm.
We never were taught that. We don't really know. And it's like, wow, how unfortunate is that? That, we can, but again, is that Western medicine? Is that
Right.
insurance? That the pharmaceutical company? Like, there could be a, a whole host of reasons, but
Yeah.
yeah, we are not taught that at all
Yeah.
to use nutrition as medicine and to heal and to give the body what it needs, other than your basic, make sure that you avoid alcohol and eat a healthy diet and fruits and vegetables and all of that. And then
Right.
that's really about the end of that whole training.
Yeah.
And yeah, and doctors just don't know. Like sometimes, patients will say, or my clients will say, well, how come my doctor never told me this
Mhm.
before? Or why wasn't this brought up? And it's like, because I mean, they're just not trained. It's not
Yeah.
something that's taught. I can say
Right.
I wasn't taught that. I had to go out and become certified in functional blood work.
Right.
And that wasn't something that was taught to me in nursing school. So it's not their fault. They just don't know.
Right. Right.
Yeah.
Yeah. I mean, it's not a fault of theirs because what they're taught is how does this medication react to the body, what symptoms and signs and all these things. It's like, but when it comes back to, okay, the root cause is probably you neglected nutrition somewhere down the road.
Yeah.
And that started this chain reaction of, like, okay, now we've got problems that we talked about earlier. You may not see for 10 years because they're just
Yeah.
slowly creeping up. And how
Correct.
your gut and immune system and all that work. And that's a whole nother conversation that could be like, hours to
Yeah.
figure all that out and talk about it. But that really comes down to then, okay, well, for parents out there, how important it really is to look at what you're feeding your kids and teaching them, not necessarily that they have to love all the fruits and vegetables and all this, but like that they need to be experiencing that on a daily basis in their diet.
Yeah, so important. And making sure that, what we are choosing, like with the processed foods and
Mhm.
additives. I mean, there are things that are in our American diet and substances that are used in our diet that are banned in other countries. Like
Right.
I lived in Italy, and there were just things that were just banned
Mhm.
from food there.
Yeah.
And I'm like, wow, that isn't something, because it's not even really like the food that you're eating, but what have they added, that we don't
Right.
know about, that's causing all of these other health, problems and things down the line. There's a lot of that. So trying to
Right.
stick to food that's just, that you cook at home, that's not really, um, packaged and sat on a shelf forever, that's loaded with preservatives and chemicals and all of that. So even those things, people might think they're making good choices because it might be a soup and it has a bunch of vegetables in it,
Right.
but if it's loaded with sodium and other chemicals that it's going to prolong the shelf life of it, then you're getting really those chemicals. And
Yeah.
so yeah, food's definitely a big one.
Yeah. Yeah. And but what I found, and see if you found the same thing, when I help somebody change their nutrition, like it takes time, right? It takes time, but it's something that as they start making that change, whether it's 6 months down the road, 9 months down the road, all of a sudden they're like, I'm starting to crave some of these healthier things, right?
Yes.
Like the cravings can switch. And so for that person that's stuck on, you know, I just can't switch to peaches because that chocolate is just so like tasty and it's just I just crave to it, or it's potato chips or whatever it is. And I don't get the same thing out of a peach. Like
Yeah.
that can come along. It just takes time down the road.
Yeah. And it's a mindset too. And really, for a huge portion of my life, I always heard like bad food versus good food. And, there's always this struggle with, oh, I shouldn't have eaten that, or I shouldn't have had this, or I shouldn't have had
Mhm.
that, because you try to eliminate things. And it really took, up until my 50s to really have a good relationship with food once I started training to compete in like bodybuilding.
Mhm.
And I realized that I was going about it completely wrong. And I ended up having to eat a lot more than
Yeah.
I was. And working with a trainer nutritionist helped me realize that no food is bad. No food is off the table. If you want that piece of chocolate, have it.
Right.
Just make sure, have your healthy choices too. So
Yeah.
when you try to eliminate foods completely, then you set yourself up for disaster. If
Mhm.
it's just, okay, I'm going to have this every once in a while and that's fine, and I'm going to enjoy it and I'm not going to feel bad about it, then it makes the other choices much, much easier. And I found
Right.
like I had to eat twice as much
Mhm.
as I was doing before. Before, in the 80s and 90s, it was all about cardio and not building muscle and
Right.
trying to be skinny, and nobody wanted to lift weights, and like salads and things like that. And then, I'm like, wow, how unhealthy and how awful it was to like think
Yeah.
all these things.
Right.
And, we need to feed the body. Of course, to build muscle, I need to feed it. I don't know why I would think otherwise. And
Yeah.
it was great to just be like, I really have to eat twice as much food, because look,
Mhm.
I found that when I was doing that, I was actually like the weight was coming off. So I was
Yeah.
not only eating more, but I was losing weight because I had, sort of allowed my body to kind of do its thing and let the metabolism the way it does. And if I try to tweak it and not feed it, it's going to just shut down. So yeah, the food is the relationship with food, how you look at food, and all that has a big thing too. So it's okay to have those treats, but
Yeah.
yeah, and eventually you will find over time that I was craving healthier things. I was like,
Right.
wow, because I found and I realized over time how much better I was feeling physically. Like my energy had increased, my mental clarity had increased, and I was sort of craving how I was feeling because I was making these better health choices.
Yeah.
And then when I had something that was unhealthy, or again, I shouldn't use that word, but say, for example, if I had a glass of wine on a weekend night, and then the next day I would feel like, wow, I only had one, but I'm sluggish, I'm
Right.
exhausted. Wow, I can really feel a difference when you don't have it and how much better you feel without it. So yeah, it's
Well, and
eye-opening.
that's really, I think, where all of us need to be, is not to the strict avoidance piece, but to the piece of, you can tell the difference when you have something,
Yeah,
because if you can tell the difference, especially when it's something that's quote unquote not good for you, and it makes you feel sluggish, or it makes you, gives you brain fog or whatever, that triggers, then you typically will go, oh, okay, well, maybe I won't have that as often because I want to be optimal. But most people don't get that feeling because they're so preoccupied with so many other things going on subconsciously at the cellular level, that they can't get that reaction,
yeah,
or they just don't feel it because they always feel brain fog or sluggish,
yeah.
and so
They
they're
don't
not
they don't know
realizing
any
that
other
it's just,
way. Yeah.
yeah. And so that's what I think, when people, and that's what I tell people, it's like, when you can feel that difference, that's when we know we're heading in the right direction. Because, not that I want you to avoid those things like for the rest of your life, I have ice cream, it's dairy free, but I do it on special occasions. It's not every night like I used to do in college.
Mhm.
It's just like, okay, well, we're going to celebrate something, I'll have some ice cream and we'll move on. And yeah, the next day I may feel a little bit more, that, my run may be a little more difficult.
Mhm.
But then it's out of my system, and okay, versus like stacking on top of something else that's already
Yeah,
making everything difficult.
yeah, yeah.
So,
True.
for somebody that wants to learn more about, how do I find the root cause? How do I take this whole body approach to health versus just band-aiding one little symptom or one little pain that I've got? Like, how can they get in touch with you? How can they follow you? How can we support you?
Oh, yeah, sure. So I can be found on wholehealthalternatives.com.
Okay.
And I also have, social media, Facebook and Instagram. And what I do is I host live workshops every month, and I invite people to come on with their blood work if they have it. And I
Mhm.
try to teach them little bits and pieces of what's in their blood work. And I usually post those on my website. So wholehealthalternatives.com. I do have another workshop coming up in just a few weeks.
Cool.
And if you don't catch that one, then there'll be another one the following month. But that would be a great place if people wanted to reach out to me, if they're interested,
Awesome.
if they want to join a workshop, or really anything at all. If they have any questions about what I do, I'm happy to, to connect with people
Right.
who have questions about that.
Awesome. Well, I'll put those links in the show notes so that people can do that and make sure they get connected with you. So before we end, like, for that person that struggles with, maybe they've been disheartened with traditional medicine, and they've heard so many times that my blood work's fine, and like, maybe they're just like, okay, I'm just going to live the way I am until I die and just deal with it. Right.
Mm.
What advice do you have for them? What like, how can we help them, like, get back to an optimal life?
You know, I always say, don't give up. You know, you know your body better than anybody, you know. So just
True.
because your doctor is telling you that you're fine, it doesn't mean that they're correct. You know, it doesn't mean that they know. So don't give up. There are providers, there are practitioners out there that do care, that, you know, will work with you to get to, you know, to help you in your health journey. You just, you know, you definitely reach out and just don't take no for an answer.
Yeah. Awesome. Well, I want to thank you so much for your time and for being a guest. And yeah, like I said, I'm going to share those and be able to support you as best we can and help people get healthy.
Great. Thank you so much for having me. It was a pleasure.
Awesome. Thank you.
Thanks for checking out the Confidence Through Health podcast. Please subscribe, post a review, share this episode with those you love who need a little extra help with their health journey. Visit allinhealthandwellness.com to learn more about the coaching programs that I provide. All episodes are produced by the Social Media Cowboys, your source for all online marketing needs. Go to socialmediacowboys.com for more information.